Welcome to Keystone Academy. This presentation focuses on EasyPro Full Denture Conversion System. The EasyPro System combines multiple innovative features to offer a streamlined workflow. EasyPro simplifies converting a removable prosthesis into a temporary, implant-supported, screw-retained restoration. The EasyPro Laboratory Kit comprises of all the instruments required for the simple conversion workflow. The kit includes intaglio and occlusal drills, drill guides, laboratory burr, reamer and manual hex driver. The EasyPro units come in either 4 or 6 mm in height. We recommend using the 6 mm height coping if there is adequate vertical space in the denture. In cases of limited vertical height, default to the 4 mm coping. All components are pre-assembled, ready for ease of use and packed sterile in a pouch together with the EasyPro retaining screw. The EasyPro unit fits to the Universal Standard Platform multi-unit. Install the EasyPro unit over the multi-unit abutment using the convenient attached peak handle to hold the EasyPro pre-assembled components. Use the manual hex driver in a clockwise direction through the access channel in the peak handle to close the tie-temp base coping screw. Tighten by hand, not exceeding 15 Newton-centimeter of torque. Repeat this procedure for the remaining abutments. You may now remove the handles using gentle tilting motion until they disconnect from the EasyPro unit. Use marking paste or inject silicone wash into the intaglio surface of the denture to mark the position of the EasyPro units. With the laboratory burr provided in the kit, relieve the marked areas to allow space for the EasyPro tie-temp coping. Ensure not to perforate the occlusal surface. Place the O-ring over the tie-temp coping to retract the surrounding soft tissue away from the retentive grooves of the coping to ensure a secure pickup. In some cases, an O-ring may be needed to protect the exposed concave collar of a multi-unit abutment to ensure the reline material does not catch the undercut area of the gingival cuff. Close off the screw access channels. Check to be sure the denture seats passively over the EasyPro unit. Reline the denture intaglio surface over the preparation for the tie-temp copings. Place reline material intraorally around the copings for improved bonding. We recommend the use of a material that may be injected into the denture tie-temp cavities. Using a material that functions with a simple injection handgun will simplify the procedure. In the absence of such a material, conventional self-curing acrylic may be used. Follow the IFU of the material used. It may be necessary to paint a layer of bonding agent prior to adding material. Voids can be filled using a flow material. The friction fit drill guide may be used as a protection cap to ensure the flow material does not run inside of the anodized tie-temp coping. After allowing for the required setting time of the reline material, remove the denture by using a gentle rocking motion. Please note that in the unlikely event that one of the tie-temp copings failed to pick up, simply repeat the procedure and reline the coping. The unique friction fit seating of the tie-temp coping over the base coping facilitates accurate seating without the need of retention screws. Depending on the margin of the multi-unit abutments, the O-rings may remain inside the denture. Remove the O-rings using a straight dental probe or any small instrument. The denture is now ready for trimming. For your convenience, you may seat at this stage the optional EasyPro base coping retrieval tool prior to denture preparation and trimming. Take the intaglio drill to prepare the screw access channel from the intaglio surface using either the standard or short drilling guide, depending on the denture thickness. Now continue with the occlusal drill. EasyPro offers accurate drill guidance from both intaglio and occlusal aspects, ensuring an accurate orientation of the screw access channel with a simplified procedure. We provide a manual reamer that will assist to remove any light debris that might remain in the screw access channel. We recommend you evaluate the correct seating of the tie-temp retaining screw. The apical portion should almost reach the base of the coping, as indicated by the blue line. Now you have verified the correct seating, you may complete the trimming, shaping and polishing the denture. Having completed the shaping and polishing, continue to the next step. Remove the tie-temp base copings from the multi-unit abutments. If you have chosen to use the optional base coping retrieval tool, then you may do so by turning the driver counterclockwise, release the base coping screw, and use the grooved portion of the handle to safely remove the coping and screw. Push out the components using the manual driver through the handle to release the components carefully over a surgical tray. Using a convenient tool such as a college plier, pick up the base coping and insert the base coping into the Ti-Temp anodized coping press firmly to ensure correct seating. Take note, the base of the Ti-Temp anodized coping must make intimate contact on the rim of the base coping. A tactile sensation of friction will be felt. Repeat this process for all copings. Insert the bridge using the anodized EasyPro retaining screw check for passive fit, occlusal contacts and soft tissue contour. Thank you for watching. To learn more about EasyPro full denture conversion system, please visit us at www.keystonedental.com or contact our customer support team.